Thank you very much. I'm Sevil Ismayilova. I'm from Azerbaijan. Dear colleagues, now I would like to present you our study named Oral Glucose Tolerance Test 90 minutes values in prediabetes detection. Sorry. As you know, diabetes is a widespread disease. Prevention of diabetes is one of important issues of medicine. When we talk about the prevention of diabetes, the first stage is prediabetes. Prediabetes is a serious health condition where glycemic levels are higher than normal, but not enough yet to be diagnosed as type 2 diabetes. It's considered to be an at-risk state with high chances of developing diabetes. With early detection and correct diagnosis and optimal approach, prediabetes can be normalized or its development slowed down. The International Diabetes Federation estimates that the worldwide 541 million individuals aged between 20 and 79 years have impaired glucose tolerance. In 2019, this number was 373.9 million, and these numbers are projected increasing to 730 million by 2045 year. The risk factors for developing prediabetes are the same risks as those for type 2 diabetes. You are more at risk of prediabetes if you are an adult who is overweight or obese, if you have a close relative with diabetes, such as parent, brother, or sister, if you have sleep disorders, if you are a woman with polycystic ovary syndrome, if you are over 45, if you have high blood pressure as more than 140/90, or you are on therapy for hypertension, if you have low HDL cholesterol or high triglycerides, if you have a medical condition that requires long-term steroid use, if you had gestational diabetes during pregnancy, if you are physically inactive. Prediabetes is not only associated with high risk of progression to diabetes. It also provides an increased risk for micro and macrovascular complications. Complications which are in both diabetes and prediabetes included retinopathy, neuropathy, nephropathy, cardiovascular, cerebrovascular, and peripheral vascular disease. The diagnostic tests which are used for diabetes are the same for prediabetes detection: glycated hemoglobin, fasting glucose, and 75-gram oral glucose tolerance test. Prediabetes occurs in individuals as impaired fasting glucose, impaired glucose tolerance, and high-risk glycated hemoglobin. However, what are the recommended numbers for these diagnostic criteria? Unification of the approach to the diagnosis of the prediabetes is hardly doubt. The borderline between prediabetes and diabetes recognized by all, as well as the upper and lower bounds of prediabetes, according to the results of glycemia 120 minutes after 75-gram glucose loading, they are still ambiguous regarding glycated hemoglobin and fasting glycemia. The differences between various international professional organizations are summarized in this table. The American Diabetes Association recommends all three diagnostic criteria in the diagnosis of prediabetes and has a lower cutoff value for fasting glycemia, 100 to 125 milligram per deciliter. For glycated hemoglobin, it is recommended 5.7% to 6.4% as a prediabetic number. The World Health Organization and International Diabetes Federation don't recommend using glycated hemoglobin as a diagnostic criteria for diabetes. They have defined prediabetic number for fasting glucose of 110 and 125 milligram deciliter. And they have defined prediabetes as in two indicators: fasting glucose and oral glucose tolerance test. In the other hand, the Canadian and Australian Diabetes Association use all three diagnostic criteria for prediabetes. detection as American Diabetes Association. But there is a difference here. They recommend a slightly higher prediabetic number for glycated hemoglobin, 6 to 6.4%. Additionally, our association, Azerbaijan Association Endocrinology, Diabetology, and Therapeutic Education, suggests all three diagnostic criteria for prediabetes, and numbers for them are: for fasting glycemia, 110 to 125 milligram per deciliter; for glycated hemoglobin, 5.7 to 6.4%; for 2 hours, 75 gram glucose oral glucose tolerance test, 199 milligram per deciliter. At the same time, as you know, the prediabetic numbers used for the 2-hour oral glucose tolerance test are the same in all recommendations. What about other points? Glycemic level after 30, 60, 90 minutes after 75 gram glucose loading. Can we use them for prediabetes detection? And in order to get answer this question, we have started research. The aim of our study was to find out the capability of PG90 minutes value using as an indicator of prediabetes and determine the optimal cutoff point for separation of normal and impaired glucose metabolism by PG90 level. For carrying out this study, we used data from database of Azerbaijan Association of Endocrinology, Diabetology, and Therapeutic Education. The study was conducted on 134 cases. The age range was 79 years. They were used height, weight circumference measurements from anthropometric data. From laboratory examinations were used samples of glycated hemoglobin, fasting glucose, and glycemic levels after 30, 60, 90, and 120 minutes after 75 gram glucose loading. Body mass index was calculated. A statistical analysis of the collected data was conducted. 87 people have normal glucose metabolism and 47 people have impaired glucose metabolism. Out of 47 people, 41 have prediabetes and 6 have diabetes. In both groups, the prevalence of female was higher than prevalence of male. In normal glucose metabolism group, the prevalence of female was 80.5%, and in impaired glucose metabolism group, the prevalence of female was 68.1%. And at the same time, there were no statistically sanctioned gender differences between the analyzed groups. And the main characteristics of two groups are presented here. We use the average values plus minus standard deviation in this study. The statistical assumption of the differences between the average values was determined by the student's t-test. Here we are presented parameters as age, height, and weight. As it is seen, normal glucose metabolism group was younger and thinner. Here we are presented parameters as waist circumference, body mass index, and systolic, diastolic blood pressure. And as a normal group had lower blood pressure. Here are indicators as fasting and glycemic levels after 30, 60, 90, 120 minutes after 75 gram glucose loading and glycated hemoglobin. As it is seen, normal glucose metabolism group had lower glucose metabolism indicators than impaired glucose metabolism group. Then the relationship between PG90 and glycated hemoglobin and PG90 and fasting glucose, PG90 and PG120 was studied by using correlation analysis. The correlation coefficient between PG90 and PG120 was 0.85. And the correlation coefficient between PG90 and fasting glucose was 0.53. And this coefficient between PG90 and glycated hemoglobin was 0.71. As it is seen, the relationship between PG90 and PG120 was as well as between PG90 and glycated and fasting glucose level. All of three correlation coefficients were statistically sanctioned. And here P was less than 0.001 for each of them. Differences between correlation coefficients were non-statistical. The equations for PG90 cutoff point was calculated by applying the multiply regression method. If the upper limit of the norm of the norm for the glycated hemoglobin is 38 millimole per mole, if the upper limit of the norm for the fasting glucose is 109 milligram per deciliter, and the upper limit, the norm for PG 120 is 139 milligram per deciliter, the received number for PG 90 is 168 milligram deciliter. For the determination of the qualitative characteristics of the diagnostic tests, they were used indicators as sensitivity, specificity, and positive, negative, predictive value, and overall diagnostic accuracy and Uden index. And we conducted a qualitative analysis of the points below and above the cutoff point that we obtained. And so the highest normal value for PG90 was 168 milligram deciliter and had 53% Uden index. Accordingly, we did a qualitative analysis of the other indicators which are used in prediabetes detection. As it is seen, Uden index was maximal for fasting glycemia more than 190 milligram per deciliter. Uden index was 68.9%. Below for glycated hemoglobin, the Uden index was 66%, and minimal was for PG 120, 44.7%. It's necessary to note that Uden index below 50% shows not so good quality of using cutoff point. It's very interesting that PG 120 minutes more than 139 milligram per deciliter cutoff point is only generally accepted indicator for prediabetes diagnostics. Finally, the cutoff point PG90 may be used for normal glucose metabolism and prediabetes detection, differentiation. Thank you for your attention.